of Healthy Indoors Magazine. I'm joined by my co-host again, Donald Weeks, who is the president of the Indoor Environmental Quality Global Alliance, coming to us live from Ottawa, Ontario, Canada. Hey,
Hey, how are you today, Bob?
good. It's been a while.
Yeah,
We didn't have an episode last month, but we're back, and this one just looks to be a really good one. I'm very excited about today's guest and today's topic. So
yeah,
how
it should be a
so
lot of fun.
Yeah. So I guess without further ado, right, we should, and I'm going to let you do the formal introduction. So with us today is Dr. Sherry Marcham. Welcome.
Hello.
Hello, Sherry. How are you today?
I'm good, thanks.
Good, good. Good. She and I have worked together many years. And so, Sherry, you're at, could you describe exactly what is the institution that you work for at the
Oh,
moment?
Embry-Riddle Aeronautical University. So
And what
I'm
is your
the
role there?
I'm the associate professor and program coordinator for the Master of Science in Occupational Safety Management at Embry-Riddle's worldwide campus.
And you can see some of your credentials there. You're obviously a PhD, CIH, CSP, CHMM, and an FAIHA, which is great. As all full disclosure be aside, Sherry and I have known each other for many, many years and worked together on a number of causes, projects. So I think this should be a fun interview today, Bob. So, Sherry, could you give us a little bit of background in yourself? How did you get interested in public health, industrial hygiene, things of that nature?
Well, there's a story there. There's always a
Okay,
story there, right?
always a story.
So when I grew up during the era of Dow Chemical and Phillips 66 and DuPont, Better Living Through Chemistry, right?
Hmm.
And so I wanted to work in a laboratory, and I got an undergraduate degree in biology. And I found a job in a laboratory that was doing environmental analysis. And so this was in the 80s. And somewhere in the early 80s, we had the VA hospital, which was just down the street from us, came to us and said, "Can you guys do asbestos analysis?" And we said, "We'll figure out how." And so went to school, went to Macron, learned everything we needed to know about doing asbestos analysis, eventually got a big contract at Tinker Air Force Base to do one of the initial surveys. And if you can imagine an Air Force Base, that was a massive project, absolutely
Yeah.
massive project. And the contract did require the signature of a certified industrial hygienist. And there were only 3 in the state at the time. And so we had all this work that was done and all of these surveys and all of these people that we hired and all of the analysis that was done. And by the time we got the final project done, the particular CIH we used came in. I don't think he read the report. He put his signature on it and sent us a hefty bill. And I said, "How do I get to do that?" Right? So fortunately, just down the street, across the street from the VA hospital, OU Health Sciences Center had a master's degree in industrial hygiene. And so I pursued that, got my master's degree, got my CIH, and then I got hired by the University of Oklahoma and furthered on and got my PhD. And I spent 26 years at OU. And what was interesting about that experience was that primarily the industrial hygiene issues that were there were all indoor air quality issues.
So is that were there laboratories as well, or is it mainly the indoor air quality?
Oh no, there were hundreds, literally hundreds of research laboratories. And that's where my experience with the biosafety and the bioaerosols came, because in the medical research industry, there are quite a few microorganisms, viruses, recombinant DNA, an enormous amount of biological hazards in the laboratories.
Right, right. So you were responsible for that as well as the indoor air quality in
Oh
offices
yeah.
and dormitories and all the other rooms. How big a campus was that University of Oklahoma?
So we have 3 campuses. One is in Norman. The main one is in Norman. The Health Sciences Center is in Oklahoma City, and then there's a Tulsa campus.
Hmm.
Plus, and it's because it's a health sciences center, there are multiple campuses throughout the state where there are clinics, and so it's quite a big enterprise.
Did you have more than just yourself to doing the work? Or?
Yeah, fortunately, yeah. Then we had a staff of about 5 to 7. It just kind of depended on where we were at the time. And then the Norman campus, they put me in charge of the Norman campus like in mid-career, and there was another 5 to 7 in the Norman campus. So yeah, I had some help, but it was slim. I mean, it's a state agency, and so funding is always tight. But we were responsible for environmental health and safety issues. So all of the environmental issues, as well as you name it, we had that responsibility.
So I mean, you were involved with things even beyond like indoor environmental. You're dealing with natural disaster type issues and the weather events that are happening in that region and that sort of thing, or I mean, under the scope of that, or not necessarily?
Well, it depends. Of course, we had a police force, and so we were training them on emergency response. We actually had the Murrah bombing during my time there, and so we were very close to the building, and so we had some emergency procedures in place that we learned from that. And of course, I live in Oklahoma, and so tornadoes are always an issue, and downed aircraft could be an issue because we had helicopters flying patients in, and so it was quite a diverse list of expectations for our department.
So what would you say would be the most interesting work project you did in indoor air quality to date?
Well, the most interesting one is the electronic cigarettes. And so that came from the Health Sciences Center. The vice president at the time came to me and said, Sherry, we're a health center. We ought to be promoting smoking cessation. So should we be promoting vaping on the job? Should we allow people to vape on the job? And at the time, I think that was 2014, I really didn't know a lot about vaping. And so I started looking into it, and I rapidly discovered that there were a number of indoor air quality issues associated with vaping, and put together a preliminary report to the vice president and said, no, not only should we not be allowing people to vape at their desk, we really need to think about not encouraging them to vape because there's still a nicotine problem. There's still other health problems. But that then expanded because I was so enlightened into what vaping was that I took that to AIHA and the Indoor Environmental Quality Committee and said, we need to research this. We need to scientifically show what we know about vaping. And from that, the first white paper was published through AIHA.
And yes. There are issues. I mean, there are issues, not just for the person that's vaping, but right for the environmental exposures to the vaping, right?
Right.
Where, and that it was purportedly wasn't though. That was the big thing about vaping. Oh, you don't get the ETS issue.
Well, it's just water vapor. What's the big deal, right?
Yeah.
Yeah. Right. No, it's not just water vapor, right? And so there's quite a bit of literature out there that shows that there's secondhand vaping as well. And then when I left OU and became faculty at Embry-Riddle, there were some research fundings available. And so one of the things that I was able to do was work with Dr. Evan Floyd at OU. And we were able to show that the nicotine from the vaping can deposit on surfaces. And we thought, well, nicotine on cigarette smoke, it's those really sticky particles, and it kind of, how when you go to somebody's house or your great aunt, whatever, smokes and it's yellow walls and it's really sticky. And that's kind of because of the tar and the particulates in the cigarette smoke. And we thought, well, with vaping, maybe it'll just all evaporate. And what we found was that it didn't. And it persists for several days. And the problem with nicotine persisting on surfaces for several days is that potentially it can form TSNAs, which are carcinogenic. And so we were able to show that it lasts up to 14 days and even longer on surfaces.
And when it was on surfaces, obviously you mentioned it turned some of this yellowing took place on the walls. Was it also a health hazard in what sense? How did people, from that material that was accumulating on the surfaces, was there a real health effect associated with that?
Well, and that, the only thing we can think is the hand the hand to mouth, kids crawling on the floor. Also, the thought might be, so in a hotel room, like you vape in your hotel room because the smoke detector may or may not pick it up, right? But then housekeeping staff could come in and then they'd have to clean all the surfaces. And I talked with a gentleman from one of the hotel chains who said, should I be concerned about my staff? Because we generally send a bill. If somebody's caught smoking in their hotel room, they send them a cleaning bill. But if somebody's caught vaping in their hotel room, how do you catch them in the first place? And how do you know what cleaning processes are needed? So I think it's still a real big issue. And I think that more needs to be done in research.
So, I mean, the white paper that you mentioned from AIHA, I assume, if I remember correctly, that's available. Is it at no cost or low cost? I can't remember.
Oh, no, it's free. The AIHA white paper is free. We updated it in 2019, I think we updated it with additional research. And so look for that on AIHA's website.
Yeah, no problem. We'll actually maybe put up the link as well, and for some folks who are asking it in the chat. So that was one of the ones that you did, but I remember you're working on a number of other ones, PCBs, formaldehyde, and of course we worked together on a natural disaster one, such as tornadoes. Can you tell us again what you've done in terms of, say, PCBs? What has been your experience with that?
Oh, well, you picked probably the one that I've practiced the least in.
Okay.
So on that particular guidance document, I was just one of the team members. I think that the best one of the list that you've provided is the disasters one. So that came about because when I think I was chair of the Indoor Environmental Quality Committee, or at least on the officers list, and there was some significant flooding in the Carolinas, and maybe 2017, 2018, something like that. And AIHA reached out to the IEQ committee and said, quick, let's get some material together about mold.
Right.
And we said, okay, but mold really isn't the first issue we need to worry about. There's a lot of other health issues associated with flooding. Mold will come, it will come, but there's other issues, raw sewage, electrical hazards, all of those other things that are associated with heavy flooding. And so we put together guidance in a couple of days and got it to AIHA, and they distributed that to the local section out there. But I thought, I don't want to scramble like that again, right? Let's do every disaster so that we have it at our fingertips and we can pass this information out should an earthquake or a hurricane or a tornado or wildfires or whatever the disaster of the day is. We have that information available. And so we gathered a team of experts, and I herded the cats, right?
Yes, you did. I was one of those cats.
It's always a challenge.
and got some really good information available. And fortunately or unfortunately, however you want to look at it, Dr. Deborah Nelson was the president of AIHA at the time, and 2 rounds of emergency disasters went through. One was earthquake in Mexico, and then there were hurricanes in the southeast and wildfire. That's 3 wildfires in Oklahoma at the time. I mean, about wildfires in California. We had wildfires in Oklahoma. And so she was able to use the resources that AIHA had available immediately and push that information out to help folks in times of the emergency.
And again, if I remember correctly, these are AIHA papers, white papers that are available on the site for no cost.
Correct.
Yeah. So, I mean, if people who are listening are interested in those subjects, most of the publications that we'll be talking about today, with one major exception, are going to be ones that are readily available by download. So that's
and
good.
That would be at aiha.org, correct?
That's correct. Yeah. And then they go, I believe it's called bookstore or something of that nature, where you can get any publications on the website and download them directly. So one of the things I know you can do is you can go to volunteer groups and you can find all of the Indoor Environmental Quality Committee documents that were put together, and all of these, the mold ones, the formaldehyde ones, the PCB ones, they're all under the IEQ committee's website.
So
Great.
just to let you know, we have here's the actual link to the electronic cigarettes paper. We're posting it in the chat for the show as well. So Susan's already posted it there. So that's if you're watching the show, you'll be able to go to the chat box and get it. And we'll also put it in the extended comments for the show. So this will be available.
So that speaking of another disaster, looking now at the pandemic, I know you've been involved in a number of publications since that started 19 months ago. Could you kind of describe some of the ones that you've been assistant and in some cases project leader?
Well, so early on, there were 4 documents that I helped work on, which were on workplace cleaning for COVID-19, because, early on we were focusing on surface contamination and the concern also being, okay, now we're using a lot more disinfectant and chemicals to clean. And so worker protection was a big issue. And so there were 4 documents on cleaning. There was also one document that the Dental Association had asked AIH to look at on HEPA filtration in reducing patient exposure from dental procedures during COVID that I helped work on. I think the most important one that's still relevant and important is one called Recovering from COVID-19 Building Closures. And I think that I think we've opened things back up, but a lot of buildings sat empty for a while and stagnant for a while. And the issue, of course, is stagnant water in lines and potential Legionella and condensation. We had a very old building at the OU campus that had nothing but fan coil units in individual rooms. And in the summer, when there were no classes, if they didn't shut the building down properly, when they opened it back up in the fall, condensation everywhere and mold everywhere. So I think Recovering from the COVID-19 Building Closures is a really important document to help people think about, okay, I'm going to kick this back in. What kind of health effects, what kind of indoor quality concerns do we have?
And I think that's a big thing that you need to stress, Sherry, is that I think many people think once the pandemic, once it wanes, and we're really not there yet, but once it does, I think the general public doesn't really think and consider what you might be dealing with as far as the ramifications of buildings being partially shut down or totally shut down. Right, you've got that Legionella issue, as you mentioned, and there's all these hidden menaces that you create by not operating a building at normal capacity, and you just can't just forego that, right? So it's
right.
So how is AIHA pushing that information out and getting that out so it's getting to facility people and people that need to make these decisions?
Well, that's a great question. They have a COVID resource center. And again, I'm pretty sure this document, the Recovering from COVID-19, is also under the IEQ committee's website, but they have a COVID-19 resource center that has a lot of these documents.
And there was a document that you worked on for ACGIH regarding ventilation. Perhaps you want to tell us a little bit more about that one.
Yeah, so the ACGIH, this one's the most recent one that you and I both worked on, didn't we?
Yes.
Engineering controls for bioaerosols in non-industrial, non-healthcare settings. So the Industrial Ventilation Committee put together some ventilation guidelines for industrial settings, and the Bioaerosols Committee worked on the non-industrial and non-healthcare settings, because healthcare is a unique environment. So we wanted to talk about ventilation controls in the times of COVID, when the source of the bioaerosol is humans, right? So historically, we've had bioaerosol sources that have been mold in the wall, or Legionella, or in a laboratory, or in metalworking fluids, where it's really you can control the source. And when people become the source, then we have to really look at the ventilation. And one of the things I learned from the engineers that were on that team was that the difference between dilution ventilation and displacement ventilation, and that dilution ventilation, we want things to be turbulent. You want air to mix. You want it to pull a contaminant out. You're putting in fresh air, you're mixing it up, and you're pushing out contaminated air. We don't want to mix it up when we have a source of a bioaerosol. And so the recommendation that came out of that document really was that displacement ventilation, which is you have a streamlined flow where things pass through, make one pass, maybe collect it from the person and pass it out of the building. So with laminar flow rather than turbulent flow. And so that's a really good document if you're interested in how we might be able to better ventilate spaces. And knowing that most buildings weren't designed that way, but as we design new buildings, these are ways that we can think about removing those sources from the workplace.
So was that just workplace, but also was that, for example, for schools, public places of that nature, anything non-industrial?
Anything non-industrial, yeah.
Yeah, so I mean, for schools, that's obviously that's been very much in the news lately in terms of ventilation in schools. This document somewhat addresses that, but obviously there's more that needs to be said about it. There's a lot of one of these people who are selling people. I guess they're people selling these ion
Solutions.
Yeah, where you best put in a cleaner inside the school or in thousands of schools. I mean, not to put you on the spot, but I mean, basically, I know that that's not something that we recommended in the ventilation book that we were putting, or the pamphlet that we put together for non-industrial. So maybe
to be fair, he just put you
about
on the spot, though, Sharon.
Yeah, I know.
To be fair,
he does it all the time.
Yeah, you don't have any real strong opinions about this, do you?
Well, my opinions aren't as strong as some of the members of the committee. So I think that where we're at with the bipolar ionization and the let's spray something and kill the virus in the air, something is that really we need to know from the science whether that works before we start investing a great deal of money in those kinds of technologies.
Yeah, and we know that there's already been a whole lot of money invested in those technologies, and they continue to have problems in schools. I think I read somewhere in the neighborhood of 250,000 cases of related to school environment. So it's a real critical issue for schools at this point.
Well, and still, I think it's an area that we still haven't done a great job as an industry, collectively, all of us, right, in the industry, of disseminating that to the general public in a way that they really get it. Because and when I say general public too, that would also include the commercial facility side of the general that is still general public, outside of academia, outside of actual organizations. To understand, like the whole premise early on of going in and fogging buildings, the source of the transmission predominantly is direct person-to-person, transmission or aerosolized transmission. So sanitizing a building, wiping every surface down the building, that's all well and good. But as soon as you reoccupy with new occupants,
yeah,
have you achieved anything?
Yeah, I agree.
Yeah, it's tough. It's a tough environment. So we'll move on. I wanted to get the highlight of this show is to talk about a little bit about the new ACJH Aerosols book. And what is your role in that book?
So I'm the current chair of the Bioaerosols Committee, and Jack Springston is the vice chair. So it's fun. and as such, our roles have primarily been the cat herding, right? So we are updating the 1999 ACGIH Bioaerosols assessment and control book. And clearly science has changed a great deal since 1999. And so we have something like 27 chapters. And so 27 authors plus some chapters are group chapters. And so I would say maybe up to 50 authors trying to corral those authors and get the updates in a timely manner. It's really been our role.
And that's been tough, I can imagine. Besides being the chair of the committee, though, are you serving also as the editor or co-editor with
Jack?
With
Jack and I are editing the book as the chapters come in. Jack and I are editing it and putting it together and making sure there's consistency between the chapters. That's the other thing is that, when you have 27 people writing 27 chapters, you need to make sure that there's no duplication, right? There's the book. You don't want to duplicate information but you also want to have consistent information and you want to have a theme throughout there, which is, the assessment and control of bioaerosols. And we want to make sure that that everything's covered. So editing has been Jack and my responsibility as well. Yeah.
And obviously, as you mentioned, there are new materials, new things that have come up since 1999. Perhaps you could briefly tell us some of the chapters that are relatively new.
Yeah, so we've added a recombinant DNA chapter. We have actually there was not a chapter on disinfection. There was not a chapter on respiratory protection and PPE. And we've added a chapter on bioaerosols as agents of bioterrorism. But I think the main thing, the difference between the 1999 version and the current version is that primarily in 1999, the issues and the focus were tuberculosis and mold. And we've come a long way since then, right? We've had SARS and H1N1 and Legionella now, and we have recombinant microorganisms, we have prions, we have, and of course, SARS-CoV-2. So all of those bioaerosols are being discussed and addressed in this updated version.
We have a question from the audience I'll take right now. Is there a formalized guidance document available that discusses the various new air filtration technologies from either of the organizations that you've been involved with? Is there anything out there, or is this still kind of new territory for everybody here in the industry?
There's a lot of information on MERV filtration. And I would say the two documents that I mentioned, the ACGIH documents on ventilation in industrial settings and ventilation in non-industrial settings, has some good information and references the MERV information on filtration. But ASHRAE also has quite a few documents on filtration, right, Don? I'm not as familiar with those.
Yeah, no, definitely. I mean, that's their bailiwick, obviously. Refrigeration engineers or ventilation engineers. They have the standards as well. The one for 62.1 is for commercial buildings and other buildings of that nature. 62.2 is for homes. So there are plenty of them, and many of those are cited in, for example, the AIHA publications, ACGIH publications. In fact, the Industrial Ventilation Group, ACGIH, is going to be holding a conference with the ASHRAE people in June in Toronto, talking specifically about the interaction between industrial ventilation and problems in the workplace. So it's a big topic, and it certainly needs to be addressed fully. But I'm on the 62.1 committee, and we work very closely with other people on those types of issues. So I think the interesting thing about what was done with the Industrial Ventilation Committee and the Non-Industrial Ventilation Committee of the ACGIH is that they did call upon engineers that were also very prominent in the ASHRAE field, and were able to work closely with them to formulate the words, the chapters and publication as a whole. So so that's where we are right now. So when you say that there are new chapters, what is the role of the older chapters? What are you doing to see that be updated? How does that take place?
Oh, well, we're starting from scratch, basically. I mean, the authors are given the 1999 version, but they have the flexibility of providing whatever the updated science is, and we're doing our best to find experts in the field who can tell us what we need to know from an industrial hygiene and from a building management point of view of what we need to know about individual topics, whether it's metabolites from fungus, whether it's endotoxin, whether it's viruses or fungi. I mean, all of that information will still be there, and it's all going to be updated to have current information.
Sounds like a very big operation.
Yes.
And the $64 question is, when is this book coming out?
Yeah, so
that's one of the questions.
If everybody does their part
she's pointing
in
her
a
finger
timely
at me.
manner, the goal is spring. And Jack Springston has reminded us that spring ends in June. So we have till, what is it, June 20th, June 19th, something like that. I mean, that is our goal, to have it ready for publication in late spring. My guess is, probably summer. But that's the goal, is to have it done by spring so that it can be published and available to folks next summer.
Here's another one of those very pointed questions from the audience. How will the new bioaerosols edition book differ from the recently updated AIHA Greenbook? Good question.
And that's a great question. And we are we actually have some of the authors, Dr. David Miller, who is writing some of our chapters for the ACGIH bioaerosols book. But as I stated earlier, the Greenbook is primarily about mold and fungi, right? It's about primarily mold, and so the ACGIH bioaerosols book will encompass any potential bioaerosol, including SARS, COVID, TB, measles, endotoxins, all of the potential bioaerosols that we might encounter, and molds included, but
Sure.
it's just a piece of it.
Well, one of the big ones is Legionella, which has hit the this market much heavier than it had in the past since 1999. I'd say it probably took off in the early teens. There are publications out there. But what is this? Your publication, the updated bioaerosols book. What is it going to be saying, or what will be the focus in terms of Legionella?
Well, fortunately, we have Jack Springston, also very active in Legionella. So he is writing that section of the book, and it will be, you'll see it throughout the entire book where we talk about assessment. So that is one of the things that I didn't mention that we're including is information on hazard and risk assessment, right? And I think that's a big issue with bioaerosols, when to know when there's an issue. Because a lot of these bioaerosols are naturally occurring, and mold is a good example of that. And, when to know when it's a risk and a hazard that we need to address. And so there will be some information on hazard and risk assessment, but we'll also talk about identifying sampling if needed. And we're going to focus on sampling is only useful when it can help answer a question and a hypothesis, right? So not to sample first, but to do an assessment first, identify what the questions you need to have answered. If sampling can answer that question, great, but sometimes sampling doesn't need to be used to answer that question. And then how to interpret those sampling results if you in fact have them. And so there's information in each of the chapters about data interpretation, and then remediation. I'm pretty sure the remediation chapter has some information in there for Legionella on how to remediate Legionella. And so the theme will be throughout the book on, how does that impact respiratory protection and PPE? Does it vary for different bioaerosols? So it'll be throughout the book.
We have another question. I think concerns particles, and then one of the things that was noted is that 1999 publication didn't have a chapter on particles. And I wonder, is that going to be something that's going to be addressed in the revised book?
Well, not as a general particles. However, I know that allergens, there will be a chapter on allergens. So things like pollen, and I know Dr. David Miller is writing the chapter on that. We'll talk about cannabis allergens, which is a big issue. And so some of the particles you see on spore traps are things like pollen and, bits of other things. And so indirectly, those other particles will be covered if they're a bioaerosol.
To follow up on that question, because the individual that had that, mentioned that, the PM 2.5 and PM 10, EPA information, it's pretty important. And there's a lot of particles collected on spore traps, but they're being ignored, right? Because they're looking mostly for either fungal or pollen particles or fragments, that sort of thing, or skin cells. But I think I would throw in there that spore traps are not designed to look for anything else.
No.
That's not the purpose of a spore trap. It really is to look for ID fungal materials
Or bioaerosols. I mean,
bioaerosols. Well, not bacterial though.
Not bacterial. No.
Clearly.
Yeah. And so I think PM 2.5 and PM 10 have been covered extensively elsewhere, and PM 2.5 and PM 10 include way more than just bioaerosols. So in general, particles are not covered, but individual components of the particulate air will be covered.
You mentioned that the book will have an overall theme, really focusing on assessment as opposed to sampling. What are some of the components of assessment that you think will be covered by the book?
Well, the chapter's not completed yet.
So there you go.
It's not my chapter, so I didn't write that one.
But I do think the visual inspection, of course, is the most important, right? And gathering information. And we as safety and health and indoor environmental professionals can learn a lot from an overall visual assessment of the entire process, and not forgetting about outside air coming in, and then what happens to the air as it's filtered and condensed and then distributed. And so I think the assessment piece is really the critical piece, and not just walking in and taking samples, right? Knowing what you're looking for first and gathering that information. And then if samples can help, great. But a lot of times we all know that you walk in and you see a mold covered wall, you're done, right? You know it's there. Now you got to find the source.
Well, sampling is just a tool, right? It's a tool in your belt as a professional, and I think the industry has been criticized over the years for at least some practitioners in the industry for being the term pump jockey. I hate to say it, but I just said it. But that relying almost solely making decisions on the state of an indoor environment solely on sampling. Right? Your feelings on that again are that's really not the way to do things, right?
Well, the problem with sampling, and there's somebody on this call here that's writing that sampling plan chapter. The problem with sampling is the data interpretation, and that's really the issue. And that is a chapter that I'm leading a group of experts on, which is that sampling is just a moment in time. And especially with bioaerosols, there are temporal and spatial variations. I'll never forget a presentation by Dr. David Miller in 2002 because I use it all the time. And they took samples every hour on the hour in a classroom for mold. And the peaks and valleys, there were times when there was no mold detected, and there were times when there was it sporulated and there was hundreds and thousands of spores of mold. And so that's the problem. If you don't sample during that time, you're not going to catch that aerosol. And so that is one of the reasons why the ACGIH TLV book has some really good information about why TLVs aren't set for bioaerosols. And that's because the sampling, you can't do an 8-hour sample for most bioaerosols. And because of the spatial differentiation, when you do sample, it's for a 15-minute time period, and you may or may not hit when the levels are high. Also in data interpretation, unless you take a massive number of samples, you're not going to be able to statistically evaluate what those results mean. And so there's some real challenges in interpreting the data. And so you have to make sure you understand the interpretation before you collect the samples.
And I mean, there's a large part of the industry goes out and does sampling and does a very limited number of samples and then tries to, rely on those as decisive information. I think that's a problem.
Well, it is a problem. I mean, taking 2 in and 2 out and then making, massive conclusions that cost lots of money based on that, when, 2 samples in and of itself really aren't statistically able to be significantly different than the outside. Mm-hmm. They're just snapshots, and they just give you a picture of what might be there, but it cannot tell the whole picture.
I always try to use this the old proverb tale of the 6 blind men from Indostan, where they're basically a village. There's a village in the east somewhere where 6 blind men are the elders of the village. An elephant walks in. Nobody has ever seen an elephant in the village for some reason, and they're tasked with identifying the elephant. And they all come up and touch it from all different sides. One identifies it as tree-like, grabs the leg. One grabs the tail, says the elephant's like a rope. The other grabs the ear, it's like a leaf. And in the end, they're all completely right on their individual assessments and totally wrong on the big picture, because they're relying on one viewpoint, one particular thing. And I think that holds true for this very much.
That's a great analogy. That's an excellent analogy. Yeah.
So you mentioned, I think earlier, something about bioweapons. Could you give us a little bit of a detail what that chapter is going to be about?
Well, I wish I could.
I know. She and I are on the committee. We know that some of these things haven't been written yet, but
And
I
he
figured
knows
I'd
that
put her
too.
on the.
He's on the committee.
I
Yeah.
know.
That's not
He's like
fair.
putting me on the spot, right?
Wow.
What's
So
going
much
on
for
with
the
the bioweapons?
softball interview.
And we're in the middle of a pandemic, and so we have had authors who have either gotten ill or have family members who are ill, and so that's a chapter that we're struggling with right now, but we will have it ready by spring, which is June.
Yeah, about 9 months from now. That's about
Yeah.
it. Yeah.
But bioaerosols, and there are plenty of resources on bioaerosols that are terrorism potential, but it is something that has updated since 1999 that we do need to be worried about. And so we could write an entire book just on bioterrorism, but we're going to try to summarize the pertinent information that folks need to know and point folks to the other resources for more thorough information.
I think that's the only way it can be done, really.
Mm-hmm.
Go ahead, Bob.
We had another comment in the chat. David Lipton comments, his issue with sampling for molds is that the presence of molds collected as an area sample may or may not be representative of an individual's exposure. And I'd take it further. I'd add to that is there any qualifier that it's representative of medical outcomes with individuals? We take environmental sampling and people try to decide whether that's a healthy environment for people.
And sampling cannot be equated with health effects. And that's very clear in the ACGIH TLV book in the bioaerosol section that we can use sampling as a tool to tell us what's going on, but we cannot relate it to health effects.
So we mentioned the TLV booklet. If I remember correctly, because again I was on the committee, we did give off one of the bioaerosols to the chemical subs committee?
Yeah. So endotoxins. We
Endotoxins.
asked the chem subs committee because it's more of a chemical than it is a biological agent. Yeah, it's excreted from biological agents, but it acts more like a chemical. We asked the chem subs committee to take a look at it, and that's as far as we know. I mean, I don't know where they're at on it. But yeah.
One of the things we talked about is, we always said there's no TLVs for bioaerosols, but there is a potential in the case of endotoxins that they may come up with a TLV.
And there's apparently a TLV for subtle license, which I had forgotten. And so when it acts like a chemical, then it possibly could have a TLV. You know what? The Dutch have an endotoxin exposure limit, but it's been scrutinized. And so there might be enough information out there, but that's a chem subs committee's role. So.
Yeah, just so those who don't know, the ACJH has a number of other committees that work on TLVs. One is the Chemical Substances Committee, and they are basically responsible for most of the TLVs that are in the book, about 400 or so. Bioaerosols Committee has a section which Sherry referred to that describes why we don't have a TLV. And goes into greater detail than we are going to be able to do here. But it's important to keep that in mind when you go out and tell people, as you were mentioning, oh no, that you've got this much stachybotrys in the air, you're all going to die. Run for your lives, the type of thing. And it's really not related to health effects. The sampling, as you mentioned, Bob, environmental sampling is just not related to. Cannot be related to health outcomes.
There's no dose effect. We don't know that information, and that's what's problematic for the industry. I mean, are spores per cubic meter even an indicator of health outcomes?
Yeah,
I don't know. We labor on that pretense a little bit in the industry, but.
And the problem is that spores per cubic meter or CFU per cubic meter is just a group, right? It's all spores. It's all bacteria. It's not an individual species, and so the mix is different. And no matter where you take the sample, the mix is different. So making conclusions about dose responses when you're dealing with a mixture that is different every time you sample is a real challenge.
And just to clarify, so will the new incarnation of the bioaerosols book that will have, you assume that you'll be bringing some information on endotoxin from bacterial and also mycotoxins from fungal constituents in that, so there will be some discussion on that.
Absolutely.
And I know that Dr. Miller is watching us very carefully.
Yeah.
and, he mentions, which is true, absolutely true, of course. Endotoxins is not one chemical, it depends.
Right.
And so it's up to chem subs to decide how they want to handle the whole endotoxins and TLV at this point. We don't know for sure what they're going to do.
And they may decide that there's not a way to set one, and that's fine.
Absolutely. Absolutely. And then there was another question about have we found out that do we know, and from our own experience, that most IEQ investigations have consisted recently mostly of mold investigations? What do you think, Sherry? Is that what your experience has been? Or
Well, I can only speak to my personal experience. I responded to an awful lot of odors that weren't mold. And so I do think that mold, I think a lot of perception that it must be mold, right? I only have these symptoms when I come to work, and then when I go home, I'm fine. And so there's a perception that it is mold to begin with. But in my personal experience, a lot of times it's ventilation issues. It's source issues. I'll never forget the time that this woman was convinced there was mold in her workspace, and we found that the odor was coming from the pop cans. She was saving cans for recycling, and the sugar in the pop that was in the residual part of the can was, creating an odor, and that was the source of the odor. So that's my personal experience. I don't know about you, Don. What about you?
Well, for me personally, we do a lot of did a lot of governmental projects, and they were looking for more indoor air quality. They felt they had mold here in at least Ottawa. They had the mold question pretty much put to rest, and then that basically they sealed the buildings to keep the moisture out. Because well, it not only helped keep the moisture out, obviously, it also kept the snow out and other problems that you had. But it's still, we did a fair number of indoor air quality surveys. When we found something that was potentially mold, we certainly investigated it, but it wasn't the focus of most of the investigations that we were doing. So to answer the question, from our experience, at least from my viewpoint, and it sounds like from Sherry as well, we're not seeing as much mold investigations solely as we did perhaps 10 years ago when it was really a hot topic. Bob, what's your thoughts?
I would say, but I still see, as a consultant, I still see a lot with clients being driven to do mold sampling by, in commercial places by the occupants, right? In commercial buildings, in schools especially, and even individual, certainly when you deal in the residential sector and the consumers, mold is still the big buzz topic of indoor air quality. Not that it necessarily should be. I totally agree with both of you on this. That I think you're very, you're looking really narrow-minded if that's all you're looking at. And most of the mold investigations never encompass dealing with bacterial issues, which I think is like a major oversight. If you just live by spore traps, you're never going to know about endotoxins and many bacterial constituents in the environment. Anyway, but it seems like mold is still a big buzz thing that I see, and as a publisher too.
Okay. I mean, that's fine. I mean, I guess we all have different experiences depending on who it is that we're dealing with. There's an interesting question in the chat that you want me to read it, Bob?
Sure. Yeah, if you've got it.
Yeah. It's will the bioaerosols book have chapters that give an overview, integrative perspective, considering all the various topic chapters, and that in the real world, there may be situations where the exposure is a complex mix of chemical and microbial contaminants that may be synergistic.
Wow.
That's quite a mouthful, but I was wondering what your thoughts are on that, Sherry.
Wow. Great question. Great concept. And I guess I got to get writing.
Or you can get Mr. Terry Soffer's information and see if he'd be interested in writing a chapter.
Yeah, I think that is worthy of being addressed, and that it generally is a complex interaction of multiple things. I know that in the assessment chapter, we are including looking for other sources of complaints, right? Because just like what we talked about, folks want to say, well, it must be mold. And doing a full assessment might in fact identify that it's a ventilation issue, or that it's another source, or that it's, you know, something else besides mold, or even MVOCs, or whatever it happens to be. And so I do think that's going to be covered from that point of view, in that when you do an assessment, you're not just looking for mold, you're looking for anything that could be causing an issue, and integrating all of that together is in the assessment chapter.
See, and that brings it back to the point you made earlier about not, maybe de-emphasizing or defocusing sampling as the primary focus. I mean, because sampling, if you go the sampling route with things, you've already kind of zeroed in on a certain constituent you're going to sample for. So you've almost eliminated objectivity of your investigative work to some extent.
Right. And so sampling, for me, my personal experience has been that most of the time sampling is to please the occupant, not because it answers a question for me, unless there's hidden mold. But most of the time I'll do a thorough evaluation, and I will find maybe the fresh air intake, somebody closed it off because they thought it was a good idea, right? And we just need to beef up the ventilation. But after the investigation, if we find that there's really nothing that may be causing this person's concern, or we fix some other things, they just still really want to see some mold sampling done, and then we'll do some mold sampling. But that's been my personal experience. But I am aware that there are a number of cases where sampling is expected, or it's contractual. I know of a school system here in Oklahoma that has quarterly mold samples taken in every classroom because I don't know.
But I have to point out that, we're talking about sampling, and I didn't mention mold sampling necessarily, and you immediately as a professional still went to mold.
Well, because it's really hard to sample for. You can't sample for COVID.
Chemicals,
easily, right?
You can look for chemicals.
Yeah. Oh, well, yeah. And
I know it's a bioaerosols discussion. I'm going out of bounds on you anyway.
Well, sure. And CO2 measurements are really, really useful, and temperature and humidity measurements are really, really useful.
Well, measurements are different, and that's an important point. The professionals here all know that, but people that might be watching the show that may not be a professional in the industry, sometimes I think people outside the industry conflate, sampling and direct measurement, field measurements, as the same thing, and they're not at all. You're never suggesting a part of investigation that you wouldn't use direct measurement equipment. Of course you would.
But here's the point. If you sample and you find it, you still have to go find the source. Why not find the source in the first place? Right?
Yeah, that's a very good point, Sherry. And what I always told people is that, if you want sampling done, then be aware that there are consequences. That if you get results that basically are unfavorable, you're going to have to deal with that. You're going to have to live with that. So it's important to form that hypothesis beforehand, so that you just don't go willy-nilly sampling and all of a sudden you come up with something. So I agree with you, and I'm hoping things change over time, but who knows? I've been doing this for 47 years and it hasn't changed that much. So I have one last question, and this is this is the tricky one.
Oh boy, is this one that wasn't on the list? I guess we're already down there. I'm wondering what's next.
I know. Last question is basically, Sherry, where does the Bioaerosols Committee go after they complete the new book? What's their next view? What are they going to be doing after that?
I think that once we get the book completed, then disseminating the information is key. Webinars and what we can do to spread the information based on the science. And I think that's really where I hope that this book stands out, is making sure that it's based on science. And we're in a time period that's really unique, where we have the internet. You can publish anything you want, right? And there's pre-publications that aren't peer-reviewed. There are pay-to-play journals that you can publish whatever you want and they'll put it online. And so I think the key that I really want this book to focus on is science, and good science. And so once we get it put together, I hope to then spread the word and let folks know what we found in the science.
which
I think
means
what's
you have to come
impressive,
back here. You have to come back here and tell us all about the book.
exactly. But I think what's impressive too is that the '99 edition. I mean, look how many years that is held, and for the most part, is still kind of an industry reference standard. I mean, there's not many publications that hold water that many years later. So
Yeah.
it's a testament to how good the original two editions of the document were.
Mm-hmm.
So you've got a heavy role to fill.
Yeah.
That you're going to make it better.
That's
Well,
the
she has
plan.
lots of good people behind her helping her out.
Oh yeah, yeah, and lots of really good scientists that that we're counting on.
Yeah, that's not me, but that's other people who are really good scientists that can really help.
He's really good with audio-visual production, though.
Inside joke. Yeah. Okay. Thank
yeah,
you.
sorry.
Well, thank you very much, Sherry, for agreeing to appear and to appearing on this show, because we really appreciate your time and effort and what you're doing. And as I said, we've been friends for many, many years. I think you always have a tendency to downplay how really critical what you do is to the future. So thank you very much for coming. And Bob, I'll let you finish up.
See, okay, I'll be happy to. Well, first I neglected to mention, or stress the
Yes.
fact that this production, Indoor Environment Show, is a joint production of the International Society of Indoor Air Quality and Climate, ISIAC, as well as the Indoor Environmental Quality Global Alliance, which Don here is the president of. So both organizations got together with us in Healthy Indoors, at Healthy Indoors, to create this show. And we're really excited to have this opportunity to bring professionals like you, Sherry, on the show, to have open discussions and try to enlighten people on some of the new events and things that are happening. ISIAC also has another thing on the horizon that we need to discuss. The Healthy Buildings America 2021 event has been moved. The slide here says November 9th through 11th. So I'm going to jump out of that slide really quick to remind you all that the Healthy Buildings event has been moved to January 2022, January 18th through 20th. It'll still be in Honolulu, Hawaii. We'll be there. We're real excited. We're there, probably broadcasting from there, right, Don? I feel like we
so.
are. That's our intent. So a great event for you to look into and and certainly consider participating in. And you can learn more at Healthy Buildings. I just want to let me get the slide up here. This is where I missed my calling here. There we go. Yeah, there we go. There's the site. It's Healthy Buildings, HB2021-America.org. So you can learn more about the event as well as register by going there.
Oh, Sherry, do you have any final words? If you have anything else you want to say?
Well, so this is the
Aerosol book.
The next time I'm on, I will be able to show you the new book, and I'd be more than happy to come on when it's all done and it's ready to go, and I can go, see, here it is.
What will it look like? What will it look like?
We won't
have
have
a visual
cover.
guy.
Gosh, probably somebody will want to put a COVID.
Oh,
I don't
Lord.
know. I know.
If I see another one of those representations,
I don't know. That's another discussion for another day.
Yeah,
clearly.
It has been known for many, many years as the Red Book. So
I think we're going to have to go with red. I really do, because the Green Book's the Green Book. So
yeah, that's.
We'll see.
Well, you could choose a new color.
Well, we could.
There's a lot of colors.
Or maybe we'll make it like the Beatles' White Album. It does not have a cover at
all. No. Just no.
Well, again, thank you. Thank you very much, Sherry, for coming. And it wasn't as bad as you thought it was going to be.
No.
It was relatively painless, right?
Fairly.
Fairly, yeah. So I guess it's time for the sign off. So, so again, Sherry, thanks so very much for being part of our broadcast today. My co-host Don Weeks, coming from Ottawa, Canada, Ontario. I said that backwards, but that's okay. We'll be back again next month, right? That's, I believe.
Yes, that's correct. Yeah, we're going to
date to be revealed soon.
Yes. Well, it's most likely going to be November 19th, but we're waiting for finalization on our next guest. So
perfect. And here's the thing. So, this is a joint effort between ISIAC and IEQGA. We're available free to the public, general public. We hope that you continue to join us. You can watch all the previous shows. This will be 4 now. We'll have both the video of today's broadcast as well as an audio podcast up at the site. It'll be available for access. Just going to the link where you're watching the show now. And We hope to see you again soon. Tune in and by all means participate in our online chat because we'd love to hear your comments during the show. So with that, thanks again to Sherry. John, we'll see you all in about a month.